Today is World Mental Health Day, and it comes at a time when awareness and education in mental health is all too important.
Especially with all the conflicts going on all around the globe, we need to take time to lift each other up, to hear each other, right? So joining us to go over how to maintain a health mindset, our friend Nicole Ibarra, she's the director of mental health for Kaiser Permanente. Welcome, and my question right out of the gate comes from an experience I had last night on X, the platform formerly known as Twitter. So many difficult videos, I finally said I have to turn it off. What is your advice and the advice of the professionals you work with as we look at some of these really difficult headlines?
I think you did exactly what you should have, listening to your body, listening to your system. I think what's really important is that we do a self-assessment to see, am I having a trauma response? Am I having a stress response? Because we can have either kind of based on our own histories, right? Many people have experienced abuse and trauma. And so for them, witnessing some of, what's happening in the world today may really initiate a trauma response. And what we need to do to cope with our trauma response could be very different than if we're having a stress response. For example, with trauma, sometimes what happens is our frontal lobes can turn off when we get triggered, and we need to find a way to just ground ourselves back into the moment, back into reality, right? Because we might start to slip and feel like what's happening is when trauma was happening, years ago. And so what's really important is really just checking in with yourself to see, what do I need to bring myself back within that window of tolerance and be present in the moment and in my body, and then accessing care, right? There's plenty of evidence-based practices that are really successful in working with PTSD and trauma. And so I really suggest that people access those resources and learn more about them. And now, if we're having a stress response, which is completely normal and expected based on what we are seeing happening in the world, every day, and especially now, it's really important to take care of yourself, because when we don't, it really could lead to us developing a mental health disorder. Right now, 1 in 5 adults experience mental health throughout their lifetime. 1 in 20 experience serious mental health, and 17% of our youth, ages 16 to 7, experience a serious mental health disorder. And so when we don't deal with our stress, it can lead to more acute responses and mental health conditions. And so I think what's really important is developing a coping skills list, develop a plan. For our patients who are in crisis, we always urge them to develop some kind of crisis response plan, but we can do that before we escalate into crisis and really have a list of coping skills and things that can help us, whether it's taking a break, taking our dog on a walk, taking a hot bath, calling a friend, spending time with family, reading a good book, or just really kind of grounding and changing the channel, because what's going on in the world is really intense.
Nicole, it's one thing to self-regulate as an adult, but we're parents here and we're dealing with children that are post-pandemic. They have social jet lag. They're experiencing things that we didn't. And so what is your advice for parents out there when it comes to mental health and trying to communicate with our kids?
I think really just having honest conversations with kids about how it's okay to not be okay. And some days we may feel different emotions. We may feel really sad. We may have a lot of questions. And sitting with our kiddos and asking them, what would you like to talk about? What would you like to know? And being really curious about what they already know, because they may already have heard some things from their peers or at school from friends. And I think just being really curious about what they know, and in a very age appropriate way, going over some of the facts in terms of what is going on, but also really assuring them that there's plenty of adults who love them, who want to keep them safe, who will prioritize their safety, and also will help get them connected to people that they can talk to if they're having a really hard time, and really normalizing that not only is that okay, but that's healthy. And that's a really strong way that we can take care of ourselves and each other.
Something also that we do at our home, especially when the headlines are so difficult, I say look for the helpers, that famous Mr. Rogers quote, because it's so important, I think, to show our children that yes, the world can be a brutal place, but in the midst of that brutality, there's always people out there that can be that lifeline for you, and look for the helpers. How important is it framing what they see through that lens?
I think it's absolutely critical, right? Children need to go through the world and move through the world feeling like they're safe, feeling that they're cared for, and even helping identify who are those adults, who are those safe people that you can go to if I'm not around, if the parent is not there, for example, or the caregiver. So I think that's great to have them identify kind of ahead of time who they feel like they can talk to and confide in if they're feeling scared, if they're feeling unsafe, if they have some questions that they feel like they need to address in that moment, and really just, make sure that they feel like they can they can talk, they can go, and they can take care of themselves.
Thank you so much, Nicole, and enjoy the rest of your day.
Thank you so much. You guys take care of yourselves as well.